Thank you and welcome back. Today we have a wonderful guest. It's none other than Dr. Joe ISSAC, MD, Homeopathy, PGCR, MF London, former head and professor of Government Homeopathy Medical College, Trivandrum, Kerala, India, visiting professor at various foreign universities, former Central Council of Homeopathy member, former chairman, CCH Postgraduate Board of Studies, member faculty of Homeopathy, University of Kerala. The topic is relationship of remedies in practice. We all know that a lot of persons are leaving India to abroad, study abroad. At the same time, an interesting one, a lot of foreign doctors, especially the super specialists, are coming towards India to study homeopathy. That's the most important thing. Hundreds of students are there in our Joseph Academy. And today's topic is the relationship of remedies in practice. Most important that the heading is also interesting one, and it is not the medicine but the remedies. When you prescribe a remedy, then only become all these things are applicable. One of the most pioneer in this subject is Calvin. You can see the drug relationship of homeopathic remedies. So on behalf of IFPH, welcome Jokes Isaac sir. You can have the platform for next 45 minutes. It's all to you.
Thank you, Dr. Manoj. Can you hear me?
Yes, sir.
Okay. Thank you, Dr. Manoj, and also the IFPH for giving me this opportunity. And today our topic of discussion is the relationship of remedies, which is usually not usually a neglected part of the study of homeopathy and practice. Because when we look into the whole medical scenario, what we see is homeopathy has a very good uphand in the treatment of chronic diseases, because as all of you know, nowadays the number of chronic diseases each person has is increasing day by day, and the pattern of chronic diseases throughout the world are the same. The 5 or 6 chronic diseases which are mainly there in the whole world is high blood pressure, high cholesterol, high blood sugar. Then we know allergies, hormonal problems. So this constitutes about 70 to 80% of the total number of chronic diseases throughout the world. And in the treatment of such diseases, homeopathy stands number 1, because a cure can be possible only with the alternative systems of medicine in this chronic disease. Actually, when we hear many things about homeopathy in our forums and outside, my opinion is homeopathic doctors should concentrate on the chronic diseases, because we only can cure chronic diseases safely, without side effects, and in a permanent way. Many times what we see is people are taking medicines for this type of chronic diseases from beginning to end. Till their death, they have to take the tablets. And the number of tablets are increasing every decade or every 5 years. It slowly increases, and this is their way until they have to take it till the end. But with a proper homeopathic treatment, according to the chronic disease theory put forward by Hahnemann, we can cure many of these chronic diseases without much difficulties. But at the same time, from our side also there are some problems, because many times we are not following Organon fully. We have half homeopaths, full homeopaths, like that. Many things are there. Anyway, that everything, the method, everything is written in the Organon, the plan of treatment. And many times how far we follow this Organon, our success depends on how far we follow the Organon and Hahnemann. But at the same time, we see a lot of homeopaths practicing with some other tinctures, low potencies, for a long time. And some of them doesn't know where to go next. Because many people used to say, I gave Rostov 30 for an arthritis patient, and it worked very well. Of course, one should know later that where to go further, how to. It is a long journey. Because if a patient is coming to you with a chronic disease like arthritis or something, it may take some maybe months and years to give a complete cure. But that cure is possible only if we know the chain of one after another, which one to give, or when we come to a certain level or certain situations where we got some relief with low potencies or a rare remedy or something. After that, how to proceed? See, one more thing what we see is in the aphorism number 221 and 222 in Organon, Hahnemann explains why we have the acute remedies, why we have the chronic remedies, and why we have the miasmatic remedies, and when to switch on from the acute remedy to the miasmatic remedy. Here, Hahnemann is giving examples of Hyoscyamus ignatia or some acute remedies, which are usually useful in the first level or the beginning of this treatment, especially when he's talking about the mental diseases. He's talking about these remedies, belladonna, Hyoscyamus ignatia, etc. And after that, what he says is you have to go, don't think that if you get a relief with these remedies, don't think that a chronic disease is cured. To cure a chronic disease, you have to go to the complementary miasmatic remedies. Also, Hahnemann says in the chronic diseases that several antisoric remedies in succession are needed in the treatment of chronic diseases. If it was that during the time of Hahnemann, it is 1,000-fold now, because we are facing patients who are having several layers and layers of miasms and all the other adverse things. So there we need one after another several miasmatic remedies. Although Hahnemann has written that several antisoric remedies in succession, that is the sentence written by Hahnemann. But now what is happening is, he was talking mainly about SORA because at that time 7/8 of all chronic disease was SORA. But now it has changed. I would say SORA is pure SORA we are not seeing at all, even maybe 1/8, maybe. Because nowadays we know that all the people have all the three miasms in different levels and degrees. So depending, and when we start the treatment of a chronic disease, sometimes we are starting from the most superficial upper layer, and the patient may be complaining of that symptom, and we are going after that. And later we see that one by one, all the hidden suppressed symptoms are coming back. And then we have to plan our strategy according to that. So,
Sir,
this is a...
It's not straight, sir. Please turn your mobile, sir.
Okay.
Yes, that's good. Okay. Yes.
So here one should know the acute remedies, the chronic remedies, or then the relationships, and how to go from one thing to another. Without that, it is very difficult to succeed in the treatment of chronic disease. I'm not talking about acute disease because acute diseases are more superficial and may not always need a complementary or a miasmatic remedy to follow. Acute remedies are usually, or acute conditions are usually, we can cure with one remedy, or it is not going to come back again and again. But if it comes back again and again, that we must understand that there is a miasm behind it, and it is a part of the chronic disease which are recurring time to time. So here our topic is relationship of remedies. How we know, as Dr. Manoj has said, he showed you a book, Calvin Nurse, Relationship of Remedies. There are a few books like Gibson Miller, which we see on the back side of the Borix repertory. There's like a pamphlet also. So there are many doctors or many authors who have talked about the relationship of remedies. But anyway, when we come to a certain level in practice, people's expectations go high, and people are coming with more and more difficult cases. And some cases we have to follow these relationships very much. And one more problem is the same remedy may be having different compatible or complementaries, etc., etc. One simple example is arsenic album. We know the complementary of arsenic album is sulfur, phosphorus, thuja. These three main remedies are complementary to arsenic album. But on which condition we have to go to thuja? Or in which condition we have to go to sulfur? On which condition we have to go to phosphorus? Like that, there are certain series of remedies. Sulfur calcarea lycopodium, pulsatilla silicea fluoric acid. Like that, there are some series also, which works very well in practice, especially when we start doing very, very difficult cases. So all these things have to be understood in a proper manner to go beyond the normal level of practice. And these relationships also are coming from various studies, both natural relationships and we see some clinical relationships which are proved in the clinic. That is it comes from the observation and experience of our authors. They have given some relationships and it all depends on, or the selection of the complementary also depends on symptomatology. And there is a natural relationship between members of the same mineral, vegetable, or animal groups. And we can see that certain families, there are certain symptoms which are running through certain families. For example, Kali group. In this Kali group, what we see is almost all the Kali groups have mainly syphilitic remedies, which have aggravation at night from beginning, which end in causticum in the very early morning. So like that, you can see the relationships of remedies, which are also, we know that there are certain remedies which have similar symptoms. We can see remedies with similar symptoms in the vegetable group, animal group, mineral, acid, and nostrils. The same type of symptomatology running through all these. Also, we should know the depth of action of remedies. Generally, we all know that the nosodes are more deep acting than many of the other groups. But at the same time, we must know that most of the vegetable drugs have the least depth of action. The exceptions are there, like thuja, lycopodium. But generally, what we speak is generally, vegetable drugs have more superficial action. But there are advantages also for that, because most of the acute conditions we are treating with the vegetable drugs. We know fever remedies like belladonna, like bryonia, gelsemium, rustox. All these are vegetable drugs, but are very useful in our day-to-day practice in acute conditions. The next depth of remedies which have more depth of action is, after vegetable, we have the animals, then the minerals, then the acids, and nosodes. So nosodes are considered the most deep acting remedies. So this also one should know, because from if a vegetable drug does not give a complete cure, we have to go to the next level, the remedies which have more deeper action. For example, pulsatilla kalisulf. Pulsatilla is a vegetable, kalisulf is a mineral. Many times it helps a lot. When pulsatilla worked well, but could not complete the cure, then one can go to kalisulf, because we can see that both pulsatilla and kalisulf has almost the same symptoms, like greenish yellow discharge, everything. So we see these relationships in the nature of many remedies. We see the same symptomatology running through the different members of the vegetable, animal, mineral, acid, and nosodes. We know that tuberculinum, one of the remedies which is complementary to belladonna, complementary to calcareous carb, complementary to many other remedies. So here also, as I told you in the beginning, arsenic album, an example which is a very, very frequently used one. In a asthmatic condition, usually after arsenic album, we go to sulfur or thuja. But in a gastric complaint, mainly we go to phosphorus, or in a skin disease, we go from arsenic alb to sulfur, like that. So that also, this relationship also, one factor in the selection of relationship is this symptomatology itself. Because that is the reason why Hanuman put the entire homeopathy prescriptions on symptomatology. From symptomatology, you can derive the pathology, you can know the more the depth of the disease, everything. But nowadays, you know that in medicine, the symptomatology, the doctors fail to understand the disease from the symptomatology, because they rely more on the laboratory diagnosis, laboratory investigations, or other methods like MRI or scan and everything. But in this way, of course, they are all useful. I am not saying that they are not at all useful, but they are useful. But the primary aim of a homeopath or a physician should be to come to an understanding from the symptoms, what is to be inquired, what is to be looked into, what can be the real underlying pathology. But nowadays, what we see is exactly the opposite. Many doctors are just, when a patient comes to them, they just send them to first, even without looking into the symptomatology, they used to send them to the laboratory for investigations or the scan. But this is not the way. The way is first symptomatology. From that, you can to make your or to confirm your diagnosis, or your if you suspect something, you can send them to further investigations. Even there are doctors who send the patient for MRI for anything and everything. So this has to be changed. And coming back to the relationships, we know that there are certain families which have family of remedies, even certain groups, for example, for acid groups. In acid groups, we see so much of weakness or debility. All acid groups have debility or weakness, starting from phosphoric acid to muriatic acid or any, because these remedies or this group have a general tendency for debility and weakness. Of course, there are other remedies like arsenic or some other remedies for weakness, like carbovage, etc. But still, acid group holds the main weakness group. Then the king of the weakness group, of course, we have read in our Materia Medica that people who have had chronic disease for a long time and suffer from weakness, the remedy is phosphoric acid. So like that, there are certain relationships. Then coming to the next, this even relationships also, we know there are different types of relationships, like compatible, complementary, then inimical, antidotal. Like that, we can see that there are lots of relationships. And to know this is not an easy job, because we don't know, we cannot remember all the inimical remedies of or all the drugs. That's a difficult thing, because the study of Materia Medica never ends. Even if you practice for 35 or 40 years also, you cannot say that you are a master of Materia Medica. Such is the number of symptoms. So at least one should know what are the complementaries in certain symptoms of a main polycrest remedies. Because we know that in homeopathy practice, many people, many experts I have seen, my seniors I have seen, who are practicing on a proper level or proper stream, are concentrating more on some 25 to 40 remedies in the fag end of their practice. Because many times I used to or I asked many people, why you are prescribing 25 or 30 remedies only? But what they said is, I'm not advocating for that, but what they said, I am telling you, their experiences they were telling me, that they said even if we use the rare remedies and superficially acting remedies, finally we have to go to that remedy, the deeper one, the polycrest. or the miasmatic depacting remedies. So many of them, because they have such confidence and because they have reached that level of confidence, they give the polycrust remedy or a depacting remedy in a hypotency in the very beginning. So that makes the difference between a newcomer and a expert. So slowly, what we have seen is, in my practice also, what I have seen is slowly I am drifting towards this depacting remedies. And the thing is, how to give it is the main thing. I'm not saying that we don't need superficial remedies. Many cases of arthritis, Rustox and Bryonia, Rustox, Bryonia, causticum, and pulsatilla are the frontline remedies. And many times it helps and it gives an immediate relief to the patient. And within a month or two, the patient feels very good. But at the same time, we know that Rustox cannot completely cure permanently arthritis patient. Even in Ken's Materia Medica, about arsenic alb, I think it was in the chapter arsenic alb, Ken is saying one thing. Arsenic alb is one remedy which we use frequently and majority of the cases of asthma or breathlessness. But what Ken says is it cannot cure asthma. To cure asthma, after arsenic alb, we have to go to its complementary, usually Thuja. So these kind of directions given in our Materia Medicas are very, very useful in practice. Because I have seen people who are giving Rustox 30 for an arthritis patient for 6 months, 8 months, 1 month, like that. I think they might not be knowing that they have this time to go to the next remedy and to go to the deeper levels. Because there is we know that vegetable drugs, I told you, have superficial action, for which cannot remove all the layers in a disease. But to remove the more deeper layers, we have to go to the deeper acting remedies. So at least one should know the relationship of 25-30 remedies which we often use in each condition. Why I say each condition is there is no permanent one like a complementary remedy to this remedy for every disease or every symptom. Depending on the symptom, depending on the disease, depending on the situation, the stage of the disease, all these, the complementary may vary, because that's the reason why one remedy has many complementaries or remedies that follow well. So why, if you know that, only you can go to the next level. And depending on that case, situation, stage, everything, you have to select a complementary. There is no fixed complementaries. And these are observations of very, very learned people. And many people used to share these experiences also. But what I think is most of our people, our doctors, our youngsters, should know this, or at least in the beginning, we all refer the books like Gibson Miller or Calviner, or there are other relationships of remedies also by many other authors. So all these are useful. And even in Elizabeth Wright's brief study course in homeopathy, she is giving a series of remedies. Like that, we have a lot of examples which we should know at least, or we should be aware of that. Aware of that means maybe if you know that, you can check this in the books when we have come to a standstill with one remedy which helps. And what is complementary? Complementary in a simple way is the one, the complementary remedy is the one which can complete the action of the previous remedy. This is a simple explanation. And there are complementaries which are, complementaries which can successfully complete the whole case or completely cure the whole case. Sometimes we need the next complementary also, because there are some patients who are after recovery, they need a sulfur calcarea lycopodium in that cycle. And that also is helpful when people sometimes are ready to continue the treatment for a long time even after the chronic disease has subsided. That helps to clear the miasmatic and the constitutional weaknesses in the individual. So the complementaries are based on symptomatology, then the nature of the remedy, acute remedy or remedies in series. Then, and usually, as I told you, this is vegetable, animal, acids, minerals, nosodes, sarcodes. That is the chain. Then it also depends on the myasm. Not only the symptom, it depends on the myasm also. We know belladonna has many complementaries. Belladonna is a first level remedy or a beginning remedy for inflammation and many conditions. But at the same time, belladonna may not be able to cure completely all the condition because it is not so deep acting. So here sometimes we use calcarea carb as complementary. Then sometimes we use tuberculum as a complementary. Like that, it changes. Even Naxomica. We can see this relationship. Naxomica followed by lycopodium, lycopodium followed by sulfur or carbovage. This was because these are the main remedies in gastrointestinal problems, which helps a lot and remove it also. Even some acute remedies like, of course, antidote is we cannot say it is only an acute remedy. It is a polycrust remedy. It can be a complementary. It can be an acute remedy. So even in antimonium tartaricum, many children who have asthma, they respond very well to antimonium tartaricum. And at the same time, they have the retching, everything, and the complementary is ipecac. Like that, you can think of Apis natramur. In most of the pyelonephritis or kidney problems, we have this Apis. Apis is the number one kidney remedy in a way. And followed by natramur, it works very well because I have seen in many cases of glomerulonephritis and all, Apis helped or to help Apis, the albuminuria stopped, the swelling stopped, and patient is feeling better. But still, it is coming back again and again once in a while when they check the urine or something, albumin is there. Their albuminuria is coming back again. And many cases where Apis helped, natramur finished the case or completely cured the case. So there the Apis, natramur versus complementary. There are other remedies also like argenitricum natramur, then baretacarb talcamra, berberis vulgaris, for example, in many cases of renal stone. Or, the king of stones is lycopodium. And many times, if it is a left-sided stone or something, we may be starting with a berberis vulgaris and then follow it up with a lycopodium. In many stones, even gallbladder stones, where the most important remedy which helped us in gallbladder stone is China. And there, in some cases, then the patient comes to us in a very acute gallstone colic. Our remedy is belladonna. And once the pain is removed a little bit, we go to China, which is the main remedy because most of these people have bloatedness, everything. China symptoms are there. And later it is followed by even lycopodium. So this relationship, like a belladonna, China, lycopodium, it helps in many gallbladder stones. And there are other remedies like there are, as I told you, in gastrointestinal problems. The main remedies in Axomica, lycopodium, carbovage. These are complementary to each other. Even in arthritis, we know Restox and Prionia, complementary to each other. Then Sabena thuja or natrum sulf thuja, petroleum sepia. All these remedies, there are lacasis and lycopodium. You can go either way. That relationship is there. Then in emotional problems, especially in women, what we see is remedies like Ignatia, natramur, sepia. One complementary or series group where depending on the age and everything, it helps. Because in many cases, if there is a recent grief, we start with an Ignatia. But if it is not completely gone, we go to natramur, which is a complementary of Ignatia. Like that, we go on, and even sepia, like that. Even there are remedies like colocynth and Staphysagra, then pulsatilla silicea. Then in skin complaints, we see sulfur graphitis. And in leucorial conditions, we see sepia and graphitis. Then there is the series remedies like sulfur calcarea lycopodium, ignatia natrum sepia, pulsatilla silicea fluoric acid, arsenic thuja, allium cepa phosphorus sulfur, aconite spongia hepar, the morning essence group remedies. Then there are the pain remedies with the relationships. So this relationship is becoming a very, very important thing once you go to the deeper level of the disease or in chronic diseases. So then we have the antidotes. Actually, many people used to ask this question whether an antidote should be given when you think that your prescription is wrong immediately. No need of it. If the symptoms are coming down, better wait until the action of that remedy is finished, even if it is not a correct remedy. Let it finish and then go to the next remedy. Always the problem is, before finishing the action of the remedy, many people used to give the second remedy. And that spoils the whole case. Also, what we have to do is, one question was there. If somebody has taken a medicine and after that they are coming to you, you don't know which medicine the patient has taken. Then how you will give the complementary? See, here we don't know the medicine, what medicine the patient has taken. There it is better to wait until the action of that medicine is finished. Because in antidote also we have different methods, like a symptomatic antidote. We have the symptomatic antidote. Then we have the universal antidote like in Axomica. And even Stuart Close is saying that if you give the hypotency of a medicine which need to be antidoted, you give the hypotency of that medicine. So like that, there are methods. So, but the best way is to wait if it is possible, and then go to the next before jumping into the next remedy like that. Because jumping from one remedy to another, as Ken says, we must be very clear, because unless and until you are very sure that the next or the action of the previous remedy is finished and the symptomatology of a new drug has come in, don't change the remedy. Unless and until that new symptom or a new remedy is indicated, very clearly indicated, don't jump to the next remedy. But at the same time, if you know the previous remedy, you can think even phytolacca mercury, there is one relationship. Allium cepa lycopodium. So like that, these relationships help us to take us to the next level. I know that we all know the relationship of some remedies, but not all. It is not possible also, but we can refer the textbooks and see what to be done next. And always the guide is the symptomatology, even this symptomatology and the disease and the stages. There are certain remedies like, for example, intercurrent remedies. How we select the intercurrent, that also is based on the symptomatology. We have to think of the symptoms, and according to the symptom, we have to think of the symptomatology, miasm. These are the two things which help us to select the intercurrent remedy. I think I have given a very superficial idea about the relationship of remedies, and if anybody has anything to ask, you can ask now.
Yes, nice presentation as always, without any screen sharing, but we feels that he's sharing the screen. It's the most important thing. The time for discussion. Those who would like to participate, please raise your Those who would like to participate, we can add. Anyway, it's a nice presentation because we must stick on the basics. Dr. Kalyan, so yes, please, you can unmute now. Yes, please.
Thank you, sir. Thank you, sir. Very nice lecture delivered by Dr. sir. One question I want to ask Dr. sir. Brownia is complementary of Rustex, and Brownia is also the antidote the Rustex. How it can possible one medicine antidote and complementary both?
Now, there are some symptoms which are same, some symptoms which are opposite. Because, the aggravation motion. Aggravation motion is there in bryonia and better by motion in Rustox. But at the same time, they have this relationship also complementary to each other. Bryonia to Rustox and Rustox to bryonia.
When it will be complementary and when it will be antidote? During the period of administration of the remedy, how we can say?
Sorry, sir, I cannot hear you properly.
Sir, Brownia is antidote to Rustex. Brownia is a complementary to Rustex. How a physician can say the medicine is going to as a complementary action or an antidote action?
No, it is there in many remedies, not only in bryonia,
No,
but
sir,
because
so medicine, only 2 or 3 medicine I have seen.
No, there are many remedies like that. Even in Gibson Miller's list, it is there.
And how we can know?
No, it can antidote. It can antidote, but at the same time, it can complete the action started with the previous remedy. So some remedies are antidotal and complementary.
Yes, sir. I don't know the most complementary antidote. How the physician can know the medicine is going to the brownia after Rustex, it work like an antidote or work like a complementary? How we can know?
Okay. So it is like this. After bryonia, you are giving Rustox. Even if that bryonia is antidoted, no problem. Rustox can continue the action.
No, sir. Satisfied to me, sir. I am not clear with you, sir.
Okay.
Yes. So often tough areas are there to have some clear-cut answer. Of course,
it is like this. The complementary, some complementary remedies stops the action of the previous remedy and then go forward. Is it clear?
After stoppage of the action of the first remedy,
yes.
If you give the second remedy, then it will maybe work like a complementary.
Yeah.
Yeah. During the period of the action of the remedy, when you use the same remedy, that will antidote to the remedy.
Yeah, even if it had antidotes doesn't matter because we are completing the previous action initiated by the previous remedy.
Just like, sir,
it is like the one first remedy might have taken you 2 steps. Sir, then the second remedy, third and fourth.
Sir, as I know, sir, in a pond you throw a stone. There is some wave start in the pond. But during the starting period of the wave, you throw the second stone in the pond. That is second wave will start, and that will be crushed to the one wave to the other wave. So this is the antidote of the condition. And if the wave is ended, then you throw the one stone. That will be another wave we start. That is work like the complementary, sir.
I cannot hear properly. That's the problem.
Thank you, sir. Due to the problem of the. Thank you, sir. Your lecture was nice, sir. No doubt.
Okay, then.
Your lecture was nice, sir. As a principle, homeopathic must be done with the principle. So you have covered all the things to the or advice to the all the homeopaths. Good advice by you.
Okay, yes. There are for example, it's an aconite. It is the antidote is sulfur, then the compatible medicine is sulfur. A lot, as ISSAC sir rightly mentioned, there are a lot of medicines similarly has some this effect.
Both complementary and antidotal.
Yes, sometimes I think there also the symptoms are the lone guide. If the symptoms are very similar, it may antidote. I think so. Then there's the Rostox and Bryonia. When the Bryonia patients presents the change in modality, he may go to Rostox. That I think that may be a proper answer. I think.
Yeah, symptomatology, and we are always selecting the relationship remedies also according to the symptomatology.
Yes, yes. Then another important thing is that to select a medicine, the manifestation, the intensity of manifestation is also important. I think Ken's material, Ken says about this aconite.
Sir,
When the symptoms
sir,
are very
Dr.
strong, in a
Sir,
strong
Dr.
patient.
Joseph
Yes, yes,
Sir,
please.
Dr. Joseph is a very learned man. One question I am asking, what about the idea of patent medicine in homeopathic, sir?
Manoj, can you repeat?
Sir, you are the senior man, you are the very knowledgeable man, sir. I know very well to you. Joseph, sir, one question I am asking to you, what your idea about the patent medicine which are using by the homeopath doctors?
Manoj, can you repeat the question?
Sir, due to some network problems, I was not able to hear, sir.
I was also not able to hear it. That's a problem.
No, yeah, I am audible, sir.
No, not clearly.
Not clearly.
Yeah.
Only I am asking to you, sir, what is your idea about the patent medicine, sir?
What?
What is your idea of patent medicine which are issued by the homeopaths?
Patent medicine, patent.
Patent medicines
which
are
issued by
for the,
homeopaths.
it is the bread and butter of the pharmacy companies, not for the doctors. And that spoils and kills homeopathy. You know, in France, you know, the sale of homeopathic medicines are very high, but very few people go to the homeopathic doctor. The same thing is happening in India also. I think 50% of the people who are taking these homeopathic patents are not going to the homeopathic doctor. And that is not according to the principles of homeopathy. We are deadly against it and we don't advocate it.
Okay. If anybody would like to participate, please raise your hand. Then sir mentioned about this around the presence of SORA, the importance of SORA in treatment of chronic diseases. Then which condition is an important suggestion. Arsenic album, 3 complementary medicines are there. So depending upon the case, have to go to sulfur, to go to the phosphorus, to go to tuja. Then also the symptoms are most important. That's a good suggestion. An important clue is also there. Then the evolution of this drug relations. Yes, now Mr. Tacit is sir, please. You can unmute now, please. Yes, yeah.
Good evening. First, thank you very much for this composite information, I will say. For me, it is rather not easy to understand some of them, but I want to learn about the situation which is encountered many times in my country. The remedy given by the homeopath is not known. So they say we use some remedies, but we don't know. They are not declared. So what will happen when we start to a new diagnose and give a remedy? How much time will we wait at the beginning, or how can we antidote the previous remedy? Is there a need for antidoting the previous unknown remedy?
See, the
Is it
main
clear?
thing.
The question is clear?
Yes.
Yeah, clear. See, every remedy has a duration of action and it varies also. but we don't know many times what the remedy they have taken already. Maybe some people have taken one remedy continuously for a long time. After that, they come to us, but we are not aware which remedy it is. See, one thing we can do is tell them to take some coffee or tea or something frequently to antidote it, and then start the treatment, start our treatment. Actually, this is explained by Kent in his lectures. What he says is wait for some time. If you think that there is the action of the previous remedy is still going on or operating, just wait, give some placebo, let that go off, and let the natural symptoms of the patient comes back, and then prescribe. That is one way. Second way is you can give some antidote, like a general antidote, like a coffee, tea, etc. So like that, you will be able to know. This is the best way, because leave some time, because every remedy has a duration of action also.
If
Okay.
Earlier homeopath gives like 1 ml, what is the duration to wait? Is there an
No,
idea?
it depends on the depth of action of the remedy, potency, repetition. So the best thing is, see, wait, that is one method. Second is to, what I used to say in my practice is I tell them to take a strong coffee for a few days and then start my medicine.
Okay.
Okay, thank you.
Is it okay?
There is one more question.
Yes, please.
That question is, when we are sure about the remedy, but severe aggravation occurs, is it possible to antidote this by coffee or something like this?
No, coffee is considered an antidote for all the homeopathic medicines according to Honeyman. And that is one way. I'm not saying that this is the only way. If you know the remedy, you can give the antidote. That also is there. Or wait until the action of the remedy is finished. And let the patient go back to its natural symptoms, then start.
Okay.
Thank you very much.
Yes.
Thank you.
Okay. Thank you, Mr. Tasitinelli, for your participation. And I think camphor is a strong antidoting factor. Sir, what is your opinion, sir?
Camphor, even in some authors says that don't put your bottle of camphor between the other remedies, because with the other remedies, because it can antidote almost all the remedies. Then some people say Naxomica is a universal antidote for many things. So these are all many methods. Even Storklo says, I told you, if somebody has taken medicine in a lower potency, give a high potency of that. So there are many methods of antidoting.
Yes.
According to your situation, you can use.
Yes, the logic is most important, I think. Yes. Then, if anybody would like to participate, you can add something. Then you mentioned about the 25 to 40 remedies, medicines that are used. That's the most important thing. Then you must have a knowledge, always conscious about this drug relations. What is the importance? And you mentioned about the derivation. It all derived from the natural information as well as from the clinical experience. Yes, that's most important. So, not from proving, that's the most important thing. I think it's a long area in the material medical. There is no derived from proving, but it's always derived from clinical experience as well as from the natural source. Then a lot of cyclic medicines are there. You mentioned about this sulfur calcare lyco and so on. Then according to situations and the people, the medicines can be given. Then moreover, the diet regimen is a very important thing. When all these conditions are applicable, only when you are applying a remedy, not a drug, not a medicine. That is often an important thing. Because a lot of persons who may argue, I gave this medicine, that medicine, but nothing happened. It is never antidoted. I gave coffee, I gave this, that. But what is the important is these are conditional. It applies when you prescribe a remedy, all these things are applicable. Joseph, sir, what is your opinion?
Can you tell me in a short?
Yes, all the drug relationship and other all factors are applicable when a remedy is prescribed, not a medicine.
Yeah.
The minimum dose, the complementary.
Yeah.
Then yes, then we must know about this second prescription. When it should prescribe, when the first medicine is first remedy is acted, then we can
Yeah.
say second prescription. That's
Always relationship comes after the action of a previous remedy.
yes, that's most
So
important.
the main thing is one should know for what purpose they gave it, on what symptomatology they gave it, and even burning. You can see that we have prior of burning remedies like arsenic, phosphorus, sulfur.
Yeah.
But at the same time, we know that sulfur is the king. So the sulfur is the senior most in the burning. Then comes only phosphorus. Then only arsenic. So this also helps. So these complementary remedies have deeper action on the same symptom or more wider action or more polycrest.
Okay. Then you said about the textbooks. Yes, Tacitella, sir, you can unmute now. Yes.
One more question.
Yes,
In
please.
the relationship books, we have two classes. One complementary and the other follows well. What is the difference between these two?
Now, complementary is more deeper and can complete the cure. Complete the cure. Complementary, we use it as a finishing remedy or to complete a cure. Whereas the follows well means, see, as I told you, in many series, we are following one after another these remedies without any side effects or without any antidotal effect. Both are different. Complementary is the one more deeper in a way.
Yes. Okay.
Thank you.
Yes, thank you. Then again, you mentioned about this medicines in succession. Well, unfortunately, this area was twisted as alternation. Alternate one after another. It was prescribed in the textbooks of the degree syllabus, but nobody is properly following that. I think medicines one after another in succession is the most important thing. Just you mentioned about this bryonia, rustox. Then in between you can give also phytolog. There's another. Then the intercurrent medicines are there. I think sir is not used to that. Not mentioned. Yours, I said, sir?
No, there are two types of intercurrent. One to increase the susceptibility, one to decrease the susceptibility.
Yes.
To increase, we usually, when patients does not respond to the well-selected remedy, we used to give a remedy which can increase the susceptibility like opium, sulfur, medorinum, carbovage, etc., etc. And there are certain remedies which overacts in every individual. That means the susceptibility, we have to, decrease it.
Yes.
There we use sometimes ignatia, exomica, etc. So there are two types of intercurrents, which increases and decreases the susceptibility.
I think around half a dozen of medicines are given Stuart clause.
Yeah. The list is given in Stuart clause.
Yes. So that you can modify
And
the susceptibility.
that also depends on the symptomatology and the myasm.
Yes. Okay. Dr. Kalyan Swarup, do you have anything more? Yes, please unmute. Yes.
Okay, sir. All right, sir. No any question. My Dr.
Okay.
Joseph, sir.
Yes. Okay. If anybody would like to participate, some other things. Then you mentioned about this role of belladonna, China in series after in case some cases like the colic.
Gallstone colic.
Yes. There's a suggestion question in the chat box. We need a discussion about this subject in Malayalam. Okay. Yes, definitely we'll have. Joseph sir, it's a request from Dr. Afsal. We need a discussion on this in Malayalam also. Okay.
Okay.
Kindly inform Dr. Sanesh which is the convenient date for you. Yes, now Dr. Nair, please, you can unmute. Yes, sir, please. Yeah.
Hello, am I audible?
Yes.
Yes, there was some network error. So I heard a question which I think the panel members did not hear. Dr. Kalyan Swarup had a question. He was asking about bryonia and rustox. So how bryonia and rustox are complementary to each other or antidote to each other. So I just wanted to repeat the question to Dr. Jose ISSAC. At the same time, I wanted to give my opinion to that question. So what I believe is, if you prescribe Restox to a case, and if you see the symptoms are not better, and if you see that you have got new symptoms, then again, if you take a totality, and then if you see the totality comes as bryonia, then in such a situation, bryonia is going to work as a complementary to the Restox. Are you getting me, Dr. Kalyan Swarup? I think this is my understanding, but I'm sure Dr. Joe ISSAC will add.
That's what I said. Complementary selection also depends on the symptomatology.
Yes.
Yeah.
I think the most important part is second, how we can antidote and complement at the same time. That you must clear, Dr. Nair. Yes, please.
Yeah, so what happens is, you should also understand, bryonia covers the inflammation and the restricted movement. So if you have covered the inflammation and the restrictive movement, then if you give Restox, it's going to help with the healing of the ligaments. And it's going to heal the fibrous tissues and the joints. So here, this if you first give bryonia and then if you give Restox, it's going to be complementary. And if you give Restox and if you see new symptoms coming up, and then if you give bryonia, that's going to antidote. Am I confusing or am I clearing the doubt? Dr. Kalyan Swarup ji, can you hear me?
ISSAC sir, Joseph sir, what is your opinion?
Yeah,
No,
Dr.
it's
Joseph
like this.
ISSAC, your opinion?
My opinion is this. Many see you have given one remedy and it acted very well. Okay. And it brought the case to a certain level. And from that level, you wanted to again go to the next level or higher level, which is not possible by bryonia. Then you may go to Restox or like that, some other remedy, a complementary remedy. But even if it is antidotal, it doesn't matter. Because already what can be done by that previous remedy is already done. So we don't need the action of that previous remedy now. We are concentrating on the next remedy. So there are many, many complementaries which are antidotal, but at the same time, there is no problem. Because the action of the previous remedy is finished. And if it is antidotal, what is wrong with it?
Okay. Yes. Yes, time to wind up the session. May I invite Taciturn sir to express a lot of thanks to Dr. Joseph ISSAC sir. Yes, Taciturn lady, please.
Dr. Jose, thank you very much for this nice presentation and information. On behalf of IFPH, I will thank you and want to see you again for the new subjects. Thank you very much.
Thank you, sir.
Still there are areas. Dr. Tanesh, anything more?
Nothing to add, sir. That's I joined just early, so I could not speak now.
Okay, unfortunately some network problems are there, so I also couldn't attend properly the program. As we all know that Joseph ISSAC sir is a wonderful personality. Always for the last five generations they are studying homeopathy and teaching homeopathy. Still his son is also doing the same thing. That's the most interesting and interesting. We must salute for that also. The remark, let me conclude today's English edition. Hope you that will be back again tomorrow. Till then, goodbye, and Dr. Shaila to continue the program in Malayalam. Namaskar.